I want to welcome into the program Dr. Bryan Ardis. How are you, sir?
I'm great. How are you, sir?
I'm doing just fine, thank you. So let's talk about what is currently happening in this country with the COVID-19. Now, I don't know how much you heard of that first segment. We were just talking about the John Lewis funeral where, you've got Dr. Fauci and you've got Robert Redfield from the CDC and you've got these experts telling us that you can't have more than 10 people. Hydroxychloroquine will kill you, even though it's been around for years. And let's push this drug called Remdesivir on you because it's the next greatest thing. So, sir, you're a doctor. Tell us what's going on with the COVID-19 and what should we be listening to?
There are some alarming things that everyone needs to know about Remdesivir. Two major things. Number one, it is not FDA approved for any condition in America. It never has been, never has it been proven safe or efficacious for any medical condition or infectious disease. That's number one. Number two, the only studies that have ever been done on Remdesivir was one done on Ebola patients in Africa 4 years ago, in which halfway through the study, the safety board took everyone that was on Remdesivir off of Remdesivir and put them on one of the other two experimental drugs because Remdesivir halfway through the trial had a higher death rate than the other experimental drugs. So that's problematic. And then if you even look at the COVID study that was done just a few months ago by the actual manufacturer of Remdesivir, it's called Gilead. They did a study on 53 positive COVID patients in China several months ago. Did you know 23% of those 53 positive COVID patients suffered as a reaction to Remdesivir multiple organ dysfunction syndrome, which is lethal. That means multiple organs were shutting down. Acute kidney failure, which is what you hear in hospitals today is one of the major causes of death for COVID patients in hospitals. And then they experienced septic shock, they experienced hypotension, and 8% of all of them had to be taken off of Remdesivir because of its serious side effects in 5 days. It's my personal opinion, the protocols that have been pushed by the CDC and the NIH, and now this emergency use authorization by the FDA for Remdesivir is the detriment and the major cause of death of COVID patients in hospitals today in America.
Well, Dr. Ardis, why aren't we hearing about this then? Why aren't we being told? I mean, if you listen to the news, if you read what's on the internet, they tell you that Remdesivir is the next greatest thing and that's going to be the cure for what ails us in the coronavirus. So why aren't we hearing this?
I am shocked that the majority of the American society and the audiences that we're talking to have never even heard that FDA had never approved Remdesivir ever prior to this emergency use. I will tell you, I find it appalling that we're actually pushing a drug that's experimental and investigational at best, has never been proven efficacious in 2 different viral studies, and we're overlooking and suppressing an FDA-approved drug like hydroxychloroquine that's been FDA-approved at least for 70 years. At least it's been proven to be efficacious in some realm for a malaria-type infection. And then we've got other medical doctors like Dr. Richard Bartlett out of Texas, who actually has proposed and shown and demonstrated he can help cure COVID patients and has 5 to 10 of them a day since March with FDA-approved drugs of budesonide and another antibiotic with zinc supplement. And he's been doing that for the last 4 months. Why are we suppressing this? There's obviously agendas at stake. I will tell you, I did a radio show 2 nights ago. It was actually taking off of YouTube already because it did not follow the recommendations of the current NIH CDC recommendations for COVID patients. I actually am telling the audience now, you should be made aware, and I produced a 12-page report to give you all the information you're not being told in the media. Documented, researched, article-based scientific evidence on the dangers of Remdesivir. If you want that report, email me at doc@artislabs.com. It just might save one of your family members' lives or your own.
That's very, very good information. Hi, Dr. Ardis. we've all seen this politicization of hydroxychloroquine. We know that video that was ripped off of every social media platform that it appeared on. This seems to be politicized around hydroxychloroquine. As far as remdesivir, I mean, can you help compare the politicization of the two of them? Because I can't for the life of me understand why American Democrats, doctors would want to suppress information about the efficacy of hydroxychloroquine, but not want to spread information like you are telling us about remdesivir.
It's very unfortunate that we have any trust in any organizations in government that should be overlooking and caring for us and giving us good information, and then have agendas that they're pushing. I'll tell you what I think is the reason for this. If you actually go right now on goodrx.com, you can actually find generic hydroxychloroquine for $6. Do you know what the current one treatment for remdesivir is? It's 5 dosages of remdesivir. They're actually charging $3,200 per treatment on an investigational drug. I think it's political. I know the lobbying power inside Washington is greatest with the pharmaceutical industry. And I believe they've got their play also in the NIH, the CDC, and by far on the FDA.
So, Dr. Ardis, let's talk about a vaccine, because we're being told that we need a vaccine to treat coronavirus. Now, we know we have a flu vaccine. We've got a pneumonia vaccine. I mean, a vaccine's not an end-all be-all, is it?
Never has been. It's never ended all of the flu strains, right? So this is being pushed on millions of people. The vaccines will do more harm, I believe, than good the faster we rush into providing one of these. I'm not even sure if your audience knows about this, but if you want to look into the scary side of vaccines, regardless if they're pushed in an emergency situation or if they've been around for years, there is what are called adjuvants that are put inside of vaccines to elicit an immune response in the body. These actual adjuvants or additives are dangerous to the neurological systems of the body, the kidneys, and the cardiovascular system. And if you listen to Dr. Richard Bartlett's interviews, he actually talks about how when the polio vaccine came out, there was such an immediate rush to produce this vaccine to halt the spread of the polio virus, that when they started injecting patients first with the polio vaccine, we actually created 10,000 more polio victims, and 110,000 more polio people received the actual vaccine. They actually went paralyzed in multiple limbs. That was over 100,000 people. This is because we rushed to actually introduce something into the body that, once again, is not proven, has been shown to be safe, just like remdesivir is being pushed on us now, and it was never proven to be safe either. I could show you all the documentation.
Dr. Ardis, I have to admit that every time I hear stuff like this, my mind goes to that Orwellian place. And when I hear about this vaccine, my concern, and I think a lot of concern for a lot of conservatives, is that this is something that could possibly be pushed on the American people. Maybe not that we are actually forced to get it, but that we aren't let into restaurants if we can't show proof of the vaccine, things like that. So we can't live our life and our freedoms are basically restricted. Am I being crazy here?
Nope, you're not being crazy. And I think it's unfortunate. I've had many patients come to me for years who work in hospitals, and they're actually told if you don't get the flu vaccine this year, they're going to do it with COVID too, that they're going to have to wear a mask or wear.
Oh, it looks like, gosh, dog it. All right, Amanda. So we're going to bring Amanda back in here. It looks like we just lost the feed for Dr. Ardis. I was going to have him give you the or the actual email where you could get. I find this interesting, Amanda, as we talk to folks. And look, you should do your own research. Don't believe what I say or Amanda says or Dr. Ardis. Go read it for yourself. But, look, I'm not an anti-vaxxer at all. If you want to give your children vaccines, if you feel safe about that, then by all means, you should do that. But I'm not going to get the flu vaccine. And I know, Amanda, I don't know if you saw this or not. I just read an article this morning that Dr. Fauci and the CDC are want to make the flu vaccine mandatory. What do you think about that?
Yeah, I am not down for that. Yeah, and along the lines of what you were saying, do your own research. There's a website, I think it's C19studies.com or C19study.com, and it basically aggregates all of the studies surrounding hydroxychloroquine, and they have little labels on the left that say negative, positive, neutral, basically these studies that have any type of result regarding hydroxychloroquine. And you can go on there and check out these studies, and it's important that we arm ourselves with this information, because what I have found, Matt, is that so many people just rely on the government. As we are especially seeing this on the left right now with Dr. Fauci. Because Dr. Fauci seemingly contradicts this president so often, the left just latches onto every single thing he says, and he's been wrong so much, and he has wavered so much. I mean, just think about the mask thing. He was basically taking information from the CDC and parroting it to our country, and, regarding masks, remember, I'm old enough to remember when he didn't think that masks were a good thing. And now all of a sudden we are supposed to wear them. And if masks actually work, which assumingly they do, because all of those folks wore them at the John Lewis funeral yesterday, why aren't we fully open with the requirement that people wear masks?
No, it's a great question, Amanda, and it's funny that we're starting to talk about this now, because coming up in the next segment, we're going to cover this. We've got the CDC, we've got Dr. Fauci, and that's the thing that I've always asked too, because I've seen the articles from your governor, Gavin Newsom, out there. He's letting all these prisoners out of prison for the coronavirus, and I'm thinking to myself, well, wait a minute. Let's ask this logical question. If masks work, why would you need to let prisoners out of prison? I mean,